They're supposed to be people that you can trust to keep you safe and healthy, but more and more doctors are bowing to the pressure of insurance companies, hospital bureaucrats, government officials, and even the court system, which all blur the line between what is healthy and what is profitable. Dr. Gregg Bloche was a healthcare advisor to the Obama campaign and the author of Hippocratic Myth, Why Doctors Are Under Pressure to Ration Care, Practice Politics, and Compromise Their Promise to Heal. Thanks for being here this morning.
Thanks for having me.
First of all, why is this happening? It seems clear that a person who is sick will go to a doctor, and the doctor should be telling them what they need to do to be healthy, prescribe drugs if that's necessary, and send them on their way.
We want what we can't afford. We want our doctors to do everything possible for us. But then we vote for politicians who promise not to raise our taxes. We go to Walmart and other such places and we buy products that are cheap, and we put pressure on companies to cut their health insurance costs. And we're putting our doctors in the middle. And that is what's happening.
I think it's really, I've heard some nightmare stories. I mean, doctors who are in practice where, insurance companies seem to be running the show. Doctors say, listen, I need to see you 6 times in order to be able to treat you. The insurance company says, nope, you get 2 treatments, and that's all we're paying for. Is that part of the problem in all this? Yes,
and that captures, that story nicely captures the reality of our putting our doctors in the middle. That we cannot afford everything that medicine is capable of providing. And we have to find a way to set limits. But we have to find a way that sets limits on the really low-value care, the unproven care, rather than care that might make a huge difference. Today, we're often doing this in blunderbuss fashion. And we're cutting back on care that could make a difference, and then paying for care in intensive care units that sometimes comes close to torturing people at minimal value.
I also wonder about the fact that, after Viagra was launched, there was a lot of direct-to-consumer marketing, and you see these commercials all the time. Talk to your doctor about this, talk to your doctor about that. Are patients also putting pressure on doctors to prescribe maybe a brand name medication where they could have gone generic, or there could have been some preventative care that would have helped the process?
I think that's part of the story, but that's not the really big story. The really big story when it comes to healthcare costs is these incredible beeping machines that are wondrous in terms of the software and the engineering, but they're really crude in terms of the biological understanding that they rest upon. So they replace our biological function in crude fashion, and therefore we keep needing to use them, and they're really expensive to use. Whereas you look at the really decisive biological advances, and oftentimes they're drugs. Most famously, the antibiotic revolution, penicillin. Today, the statin drugs, which are based on an understanding of the cholesterol metabolism cycle. These drugs achieve a big bang for the buck, and they're really cheap.
I have to tell you, though, that just kind of strikes fear into my heart, because I like the idea of machines. I like the idea of technology, something that can show me what's going on inside. But you're saying that makes us maybe top-heavy in our healthcare system?
We love our machines. We love our wonderful MRI images and the like. Yes. And sometimes the imaging offers value. Lots of times it offers minimal value, a beautiful image, and nice reimbursement for the hospital or the doctor.
So, and that's another issue. I mean, hospital bureaucrats who are saying, listen, a hospital is a business. It's not just a place for sick people, right?
Yeah, and there's the problem for a doctor. Let's say a doctor wants to go ahead with the treatment, right? Believes that there's medical value in it. But if the insurance company isn't paying, then that's the hospital that would have to eat that cost. And so the hospital puts the heat on the doctor not to admit the patient or provide the treatment. And look what would happen if the hospital did eat the cost. It really means us eating the cost, because hospitals are not charitable organizations. They're commercial operations. They make their money from what insurance companies pay them. So if my insurance company doesn't pay for my treatment in the hospital, then that hospital is going to have to, what the economists call, cross-subsidize, a fancy way of saying take money from Peter to pay Paul. And you're Peter here. And it's coming from your insurance company.
Well, speaking of insurance companies, we recently had a situation here in the state where Blue Cross Blue Shield's CEO was being paid an exorbitant amount. I believe they even had a golden parachute deal that paid him a lot of money. And, the state leaders were looking into this because apparently Blue Cross Blue Shield is legally classified as a charitable organization. Is that part of the problem, too? I mean, the fact that insurance companies are making so much money, their boards, their CEOs, CEOs are making so much money, and we don't have the money then to invest in the system and in people?
Right. Well, the optics are terrible. It's like when Goldman Sachs directors get huge amounts of money despite the bailout, right? It looks awful. And yet even the high salaries going to CEOs of insurance companies, whether they're for-profit or not-for-profit, are a tiny, tiny portion of the enormous amount that we're spending on health care. So, yeah, we ought to put some limits, especially in the not-for-profit sector. But that's not going to solve our health care cost problem.
Just lastly and quickly, if you had a magic wand and you could fix the whole system, what would you do first?
Magic wand. The problem is that this country wants a magic wand, and there isn't one. What we need to do is keep high-cost, high-tech, crude value treatments from coming onto the marketplace. If we can do that, and if we can selectively reward tests and treatments that add value, before they come on and have constituencies, have companies and doctors who believe in them and have an economic interest in defending them at all costs. That's critical.
Dr. Gregg Bloche is the
you.
author. Thank you so
Thanks.
much for being here. The book is The Hippocratic Myth: Why Doctors Are Under Pressure to Ration Care, Practice Politics, and Compromise Their Promise